Welcome to Robert Wood Johnson University Hospital's Health Talk. I'm Dr. Douglas Oshinsky of Robert Wood Johnson Physician Enterprises, Warren Internal Medicine. New Jersey is one of the most diverse states in the nation, a true melting pot of cultures, religions, and ethnic backgrounds. That diversity is recognized and celebrated at Robert Wood Johnson University Hospital's New Brunswick and Somerset campuses to ensure that we deliver culturally competent care, reduce disparities in healthcare, and develop a diverse workforce. Joining us today to discuss diversity and inclusion efforts at Robert Wood Johnson University Hospital's New Brunswick and Somerset campuses are Paula Gutierrez, Director of Diversity and Inclusion at the Somerset campus, and Vanessa Nazario, Director of Diversity and Inclusion at the New Brunswick campus. I'm sorry if I butchered your name. Thank you for both for coming to the show.
Thank you for having
Paula,
us.
why don't you tell us a little bit of background about yourself and what got you involved in the diversity and inclusion efforts that are being done at both Robert Wood Johnson University Hospital in New Brunswick and Somerset campuses?
Sure. So I've been in healthcare for the last 10 years with a focus in nonprofit work. I previously worked for the New Jersey Sharing Network, coordinating organ and tissue donation and transplantation. So I had various roles within that organization, but it was really a lot of the different interactions that I had with different patients and their families that opened up the door and allowed me to look at things with a different lens of seeing healthcare disparities and how different people of diverse communities have access to healthcare. So as I sort of thought about my next journey in healthcare, I started to look at diversity and inclusion efforts and what I could do to make a difference as a Latina and someone that speaks Spanish, helping communities that are underserved and be more inclusive to that group of people.
And Vanessa, a little bit about yourself.
So my diversity and inclusion journey, as I like to describe it, started around 25 years ago. I've worked in community development, helping low to moderate income individuals gain access to financial services. As part of that process, I saw that there was an opportunity to help other people in terms of diverse backgrounds, and that led me to really thinking about what I like to call a full-time career in D&I, and it led me to the opportunity that now I have at Robert Wood Johnson University Hospital, New Brunswick, and I've been there about a year and a half working on D&I strategies for the entire hospital and organization.
So let's talk about diversity and inclusion. 20 years ago, we would never have even mentioned something like that. However, we live in New Jersey, New York metropolitan area. We are an extremely diverse population, different economic, socioeconomic, ethnic, racial, everyone is different. That's what really makes us who we are. Right. So tell us a little bit about what we mean by diversity and inclusion.
Yeah, absolutely. So when we talk about diversity and inclusion and healthcare specifically, what we're talking about is delivering culturally competent care, right? And what that really means when you really get down to the weeds is educating all our staff around all the different cultures we serve. Because one thing we focus on is it's not about, it's the same size, same treatment for all patients. It's understanding what the patient's journey is relative to their cultural background. And that starts with educating our staff, right? So really focus on education to build what we call awareness about the different cultures, because we're really focused on equitable care, right? So that really means customizing the treatment for that patient. So really being mindful of their religion. As an example, if you have someone who's LGBTQ, right, and they're transgender, what does that mean for that person in terms of maybe their preferred name or preferred pronoun? So all these different nuances that we really take in consideration to make that experience a meaningful experience for our patients. So I go back to it's not a one-size-fits-all. So when we talk about diversity and inclusion at a global level, that's what that means in healthcare.
And the importance about that is that we, as the physician, nurse, provider, et cetera, want to make the patient better. And if we give them only one choice and don't think about their background, one, they may not follow through with what we say, and two is they may not get better because of that.
Absolutely. Yeah. So, I mean, you got to think about language, right? So that's one example of if you can't communicate with your patient in their preferred language, what does that mean for them and their inability to maybe follow discharge instructions or medications at home? Things like that, which sometimes you don't take in consideration, right? But for us, is bringing it at the forefront, saying this matters, this is important.
Actually, even higher than that, when you fill out your intake form, one of the first questions they ask is sex.
Yep,
exactly.
And at Robert Wood Johnson, Somerset, New Brunswick, as well as at Somerset Hospital, as well as the physicians associated and affiliated, most of our EMRs now include not just male or female, but again, we include the LGBTQ patients in taking care of everyone.
Yeah, so we now have adopted at both of our campuses three questions, three very important questions at the point of intake, where we ask the patient's preferred name, their gender assigned at birth, and their gender identity now. So that way, through their entire course of stay and their length of care, the providers, anyone that's involved that touches that medical record, knows how to appropriately address that individual so that they feel comfortable and they know that the individuals taking care of them are being sensitive to their needs and where they are at. So to Vanessa's point, it's not a one-size-fits-all, hence why we made these changes. So when our patients come in through our doors, they know from the point of registration that we really are taking into account and really care about delivering culturally competent care to them.
And one of those ways that we do that is we educate the staff itself. And how do we do that?
So we provide a lot of different education to our staff. Last year, we embarked on a journey through LGBTQ competency care. So we educated our staff, again, on how to appropriately address individuals and teaching them a little bit about what does LGBTQ mean and what does that all translate into when the patients come in through our door. So that's one of the pieces that we did. Now Vanessa and I both do new employee orientation on diversity and inclusion. So we educate the new staff that come in to the hospital to work with us on diversity and inclusion efforts, on health equity, and the different types of communities that they may encounter whenever they're working, because our staff is not just clinical staff. We have, to make a hospital run and operate, there are a lot of different personnel that work within the system. So making sure that everyone understands what their role is and making sure that our patients, again, receive culturally competent care. One of the other efforts that, again, Vanessa and I are doing this year is delivering diversity and inclusion training to our existing staff. So we do it for new hires, but now our existing staff, a lot of them haven't had that training. So we're focusing on training our existing workforce on how to be culturally competent and know about diversity and inclusion efforts.
Which, again, is so important since we do live in New Jersey. And because we do want to deliver the best possible care to the patient who's entering either the physician's office, the social worker's office, the hospital, the emergency room, the urgent care centers, we want them to be first and most important, comfortable. Because if they're not comfortable, they won't reveal their history for you. And as most physicians will tell you, the patient, if you give the patient enough time, they'll tell you what's wrong with them just based on history.
Yes. Yeah,
and so having the diversity and knowing, one, that there's someone who speaks the same language.
Yes.
One who understands that, their sexual orientation, very important, and how they want to be addressed.
Yeah, all those are very important factors. So as providers, as healthcare administrators, when we deliver these questions to our patients, they know that, okay, this organization cares about me. They're asking questions that perhaps other places don't ask. And they know that the care they're going to be getting is top-notch care.
And I'll just add, something else that we have to be mindful of, right, is avoiding the assumptions that sometimes we make. Mm-hmm. So, for example, if you see two men in a room, right, sometimes the natural tendency might be to think, oh, this might be a brother or a cousin, as opposed to the partner. So even raising that level of awareness within the staff and among the staff to educate them on, don't make an assumption. Ask the question of the patient. Let them tell you who the person in the room is, as opposed to saying, coming in and saying, oh, is this your brother? Is this a relative? Because that can be his spouse, right? So think about it from that perspective. So it goes back to education, as Paula stated, but really, at the end of the day, it's raising the level of awareness. Because when we come to find out, you don't know what you don't know until it's been taught, right? It's kind of, now you're exposed to it, and all of a sudden it becomes part of practice, and all of a sudden just part of the fabric of how you sort of deliver patient care at the bedside.
And again, we want to make that patient care at the bedside, at the operating room, in the emergency room, at the urgent care centers, patient-centric.
Absolutely.
Yes. We want to make sure that if their partner is either a male, female, or transgender, etc., that they're able to be part of the whole care.
Absolutely.
Yeah, it's very, very important. I mean, one of the biggest things that we are really looking at too now is we've embarked on the high reliability journey. We're trying to be a highly reliable organization, which really centers around patient safety. So you mentioned about the operating room and different types of ancillary testing that patients may come in for.
Right.
It's very important that we ask these questions at the point of intake, because if a patient comes in that identifies as a male, but their gender assigned at birth was a female, we may have to ask a question about pregnancy. for the safety of that individual and the safety, of course, for the healthcare providers. So all of these things, while they're very important as well in terms of cultural competence, they are also very big with safety, because we want to ensure that we're a safe organization and we keep our patients and our staff safe.
And the other things that are important is all of the specific ethnic communities that are out there. Do you want to name some of them?
Absolutely. I mean, we have Asian, Latino, right? We have veterans groups as an example. So there's just so many groups that we touch on a day-to-day basis. And I'll talk a little bit about what we call our business resource groups, or BRGs. And these are employee-led groups that really represent all these different communities that I just highlighted. And they really are what I like to call the face of the community within our hospital walls. So they almost serve as focus groups for us. So they help build our level of awareness internally, but then also do a lot of outreach. So to give you an example, you know, our Asian BRG group, they actually participated in an Asian Heritage Festival in Edison, New Jersey, and we sent out a huge sort of cohort of Asian BRG members to go out and do blood pressure screenings, different testing and things like that, and give information to the community. Because they're going to, you know, when that particular consumer comes up, they're going to see someone that represents them, right, the same community, looks like them, talks like them, and it makes a world of a difference. So that's just an example of one way we connect in terms of one specific ethnic community. But we have just so many other things that we do, that we leverage our business research groups to help us sort of bridge that gap into the different communities we're serving.
Yeah, we also, to Vanessa's point, our business resource groups at Somerset, we have, for example, the Vets Business Resource Group, and for Memorial Day, we were able to have a tree planting ceremony in honor of those that have served in the military. So we had a very nice unveiling to honor those folks. And we also have dedicated parking spots for veterans, which we've also highlighted. So that way, whenever we have patients or staff that come in that are veterans, they see that we have these dedicated parking spots, so they feel included, that the community is responding to them, that there's a place for them at our hospitals. For June, for Pride Month, which is National Gay Pride Month, our Proud BRG participated in quite a number of events, including the Garden State Equality Ball. We had an LGBTQ panel that we had at our Somerset Hospital. We partnered with the Somerset Patriots and had a baseball game for Pride Night. So we do have a lot of different events to highlight all of the different communities that we serve, not just internally in our staff, but also access to the folks, the patients that we treat.
It's terrific the fact that you did all of this first, even for veterans. There aren't many hospitals other than VA hospitals that do things like that.
Yeah.
And I'll just say, you know, and again, this is employee-led, right? So we have what we call a Veterans BRG group, the Business Research Groups. So these are employees who've served in the military, who pretty much help raise our level of awareness of some of the things we can be doing to make it a better patient experience. So one other thing that I'd like to mention as part of our journey is actually visiting patients who self-identify serving in the military, to actually round on them and stop by their room and thank them for their service. And we drop off a little token of appreciation. And it just makes a world of a difference, right? That little touch, that little nuance that you just kind of put into your practice just raises our patient experience sort of scores, if you think about it, and just the impact that we have on that community. I mean, Paula talked about even just having designated parking spots for individuals who serve in the military. It just makes a world of a difference. But a lot of this comes back, again, to understanding the specific needs, and thankfully, you know, we have employees who represent these communities who help us along this journey and help us understand, you know, ways that we can better connect, you know, areas of opportunities, I'll call them. So absolutely, we leverage our staff a tremendous amount of, you know, for a lot of the things that we're doing in terms of initiatives.
Yeah, I mean, in an era of HCAHPS, where we're measured by, you know, by the patients and their experience, we really take great pride in being able to provide all of these different resources to drive that patient experience forward and ensure that our patients are happy with the service that they're getting.
Again, the veterans, they're a very different breed than many people understand. And having another veteran come to the bedside with a little flag means so much of a difference to them. And the smile on their face after one of them leaves is unbelievable. Absolutely. And some of the things that they can talk about, which people who haven't served have no idea what they're talking about. They can talk about the ship they were on, if they were in the Navy. They can talk about if they were at Dunkirk, if they were here, if they were there. They have experiences that no one else has. Absolutely. And the fact that our own employees on their own voluntary time are helping to do that is also talks about the character of the people who work at Robert Wood Johnson University Hospital, both the New Brunswick campus, Somerset campuses, and all of the campuses that encompass Robert Wood Johnson, Somerset Hospital, and New Brunswick. It's the character of the people who work there, the fact that you're putting together this education program and they're all complying and doing it and finding out the importance of what it means to the patient.
Absolutely.
Yeah, it's really important. I mean, Vanessa and I participate in rounding, so we round the hospital, and oftentimes we'll round with patient experience representatives. And I'm fortunate enough to have one of the patient experience reps who is a veteran, and he leads our Veterans Business Resource Group. So I've been with him when he's gone to patients' rooms to thank them for their service and presents them with this beautiful magnet with an American flag. And like you said, it lights up, their face lights up and it changes their day. And I really feel like it also aids in their recovery to a certain extent, because they know that someone understands where they've been or what they've done, even though they may not have served in the same branch of the military. But, okay, someone here cares about me. I'm not just another patient. I'm a person.
And the fact that it's all being done at a university hospital, they don't have to go to the VA to get the care.
Yes.
Absolutely. I mean, one of the other things we did, since we're talking about military, is actually we did cultural competency education even for our social workers and case managers in New Brunswick. Well, we did have someone from the VA, the local VA office, their outreach officer, come in and teach all of us in the room, quite frankly, about sort of the military experience, all the different branches. You know, how do they access all the different resources that the VA has? So when we go back to culturally sensitive patient-centered care, it goes back to education. So we actually, embarked on making sure that our own staff was culturally sensitive around military and veterans and what that actually means for that family and that individual.
Now, just as important, we have at Somerset Family Practice the PROUD program.
Yes.
Tell us a little bit about it.
Yes, so the Proud Family Health is New Jersey's first and only LGBTQ clinic. So we are specialized and designed to treat LGBTQ patients, which is really an amazing accomplishment that we pride ourselves on, no pun intended. But we know that our patients come in the door and they know that the physicians, the front desk staff, from the people answering the phone, they understand the care that they need. So they're sensitive to their needs. They will use the appropriate pronouns. They will ask the appropriate questions and just be sensitive to not just them, but also their family, because a lot of these folks have families. And like Vanessa said before, a lot of them are same-sex couples that may have children. So not making assumptions and being educated and just knowing what the needs of that community are. So we really take great pride in the Proud Family Health Clinic. We have people that come in from an hour away because we are the only facility of that kind in New Jersey. So we have patients that come from an hour and a half away, and we have quite a long wait, but we're really trying to expand because there is such a demand and a need for it. We're expanding our services in the upcoming weeks.
Again, the only LGBT proud family practice around. Something to be very proud of.
Yes, very much.
And again, we're doing things based on diversity and inclusion.
Yeah, I mean, like Vanessa said before, it's definitely not a one-size-fits-all. So this clinic in and of itself is really very progressive, and it's a testament, and it speaks volumes to not just our organizations individually, but also as a healthcare system, that this is something that we do believe in, and it's not just something that we're putting on paper, but we're actually executing and operationalizing all of these initiatives that we talk about.
Now, as part of the LGBTQ community, I'm sure we're doing other initiatives throughout the campuses.
Yes, continued education for the staff on LGBTQ, culturally sensitive care, making sure that we address staff and even the patients appropriately. So we do continue to do a lot of efforts and continuing education to keep that momentum up and stay current with the trends and the appropriate changes that come up.
It's really not the trends, but we want to keep as modern as possible.
Yeah.
We're trying to give as modern care as possible to the appropriate people and have it as diverse and include the people as much as possible. Yeah. This isn't a fad. This is taking care of people the proper way.
Absolutely.
And I was going to add, in addition, in terms of the other things we do for the LGBTQ space, we actually have support groups on our respective hospital campuses. So we have Proud Transitions that meets the Thursday of the month.
The third Thursday of every month, once a month, and it's led by some great facilitators who are actually part of the LGBTQ community themselves. So that's really an important piece that I think people need to realize, that those that leave these support groups have gone through this journey. So whether it's parents of children that are transitioning or members of the community, these individuals have gone through this. So they can speak to it as people who've gone through it, and also with family members that are traveling that journey. So the support groups really are very robust and very helpful. I mean, I've had the pleasure and honor of sitting through these support groups, and they're very moving, and they've executed a lot of change, because parents, the one that we have at Somerset, focuses for parents of children that are transitioning. And they're all at a different stage in that transition, whether it's that they've just come out to their parents, or they're going through hormone replacement therapy, or starting their gender reassignment process. The parents in that group really support themselves and are such an incredible resource to people, to each other.
Yeah.
Which is very important, because it's a family venture.
Yes. Yeah.
And the fact that it's even being led by people who've been through it, who've probably been through much harsher treatments, and they're trying to improve that for the people who are currently in the support groups.
Yeah, they've been through it, and perhaps, unfortunately, when they were going through it, people weren't as accepting or as progressive about it, or they didn't even have the efforts that we have now at our system, where, okay, we're bringing everyone to the table to talk about this, because we need to discuss this. This is what's happening in our community. These are what our patients need. So we need to be with it and deliver that care appropriately. So they really take it all on to make sure that that the parents, the children, and everyone that needs to be educated really knows how to do that appropriately.
So we've talked about veterans, we've talked about Proud, we've talked about LGBTQ. What about generational diversity?
Generational diversity, yes, that's a hot topic. And the reason that it's so important is because if you look at our existing workforce, and not just in healthcare, but in other industries, you have 4, up to even 5 different generations working together in the same place. And hospitals are again, such a diverse place. You have Generation X, baby boomers, millennials. So how do we bring all of these people together to work together, because we are here to deliver patient care, right? So we need to do that effectively. And a lot of the folks that are working together bring forth a different set of experience. So you have millennials who are quick with the phone and very technologically savvy, and then you have the baby boomers who are very confident and have a lot of knowledge, but sometimes may not be as quick with technology. So let's bring everyone to the table, and let's educate all of our staff on what each and every single generation has, what their strengths are. So how do we bring all those strengths together to deliver the best care possible, but also how do we learn from each other? So everyone learns differently. All of these different generations learn very differently and in different ways. So we need to really look at that and hone in and have a better view, so that, you know, if Vanessa and I are working together, or we have different folks from different generations, we need to understand that there are differences, but those differences can bring us together to deliver better care.
So again, we're trying to educate our staff so that the older people who've been here for 30 years work well with the people who just were hired.
Yes.
And they both bring to the table something important.
Absolutely.
That their care in the end is actually multiplied by what the two bring to the table.
Yes.
Absolutely.
And other things that we do at both hospitals to promote diversity.
Other things, I'm trying to think like other things. I know we talked about our business research groups and our education. I mean, we also do workforce development. Something that we're very keen on is developing our own staff, particularly entry-level staff who might have aspirations of getting into other sort of parts of the organization. So one thing is doing skills development. So Jersey City Medical, for example, to name one of our sister campuses, they really, focus on our entry-level individuals and getting them education and different skill sets, so that way they can be promoted. So you might have someone who is a clinical technician who has aspirations to be a nurse, as an example. So we provide different sort of education to get that individual ready for that process. Another sort of example I like to highlight, because we also talk about how do you recruit diversity within the hospital, right? So one sort of program that I like to highlight is the Higher Newark, which actually are Newark, Beth Israel, and it's something that can be replicated at our sister campuses. They actually work with the inner community to provide them skills, training, to hopefully get them ready to be able to be hired within the hospitals. And it's an amazing program because we're dealing with individuals that are either at the poverty line or below the poverty line. And the fact that, we put them through a really comprehensive program to get them ready for work and then actually hire them into our hospitals is amazing. I mean, they get hired at MBI, they get hired at Clara Moss, at Jersey City. So we're approaching it from different angles, not only our internal, but external. So we talk about retention and then recruiting. Exactly. So that really supports a lot of our diversity within the house, within the system.
Yeah, employee retention is huge. To Vanessa's point, having these programs to encourage our, again, very diverse staff to grow and learn more and be able to do, they have a number of different talents besides whatever they're doing at the moment. So to be able to retain them and keep them in our existing workforce and develop them is really an asset to our organization.
Again, an organization that is modern, diverse, inclusive, allows people to develop, allows people to be educated, gives the best care possible because of that also. The people at the top are so smart to have done what they've done for this organization. Robert Wood Johnson University Hospital, both New Brunswick, Somerset, and its sister campuses, all showing what is important in healthcare.
Yeah, and I'll just add, it starts with leadership, to your
absolutely.
point. So our system CEO, because we're RWJBarnabas Health, is Barry Ostrowski, right? So by his sort of leadership and the leadership of the Board of Trustees to really put some fire underneath this. And now we have a corporate office of diversity and inclusion led by Ms. Trina Parks, who is our corporate chief diversity officer, to do system-level strategies that get executed at the hospital level, really helps to keep that momentum going forward. And we really think of, so what's the next thing that we can do to make it even a better sort of organization in terms of inclusion and diversity and equity, going back to the equity conversation we had earlier, right? Because that's sort of the where we want to land, is making sure that we have equitable treatment for all our patient populations. So absolutely.
Absolutely. It's not
Thank you
just
both.
having the access to the care, but making sure it gets to everyone.
Thank you both, and thank you for your thoughts.
Thank you for having us.
This concludes today's episode of Robert Wood Johnson University Hospital's Health Talk. Please remember the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral number at 1-888-MD-RWJUH. For more information about our diversity and inclusion initiatives, please visit us at www.rwjbh.org. Thank you both for being here, and thank you for everything that you bring to the system.
Thank you.